الطلبة، كل عام وانتم بخير، عيد سعيد عليكم إن شاء الله. هذا الفيديو راح أشرح به محاضرة البرين infection. Rule of radiology in cranial infection. Rule of radiology in cranial infection is first, initial diagnosis. You can help in initial diagnosis. As you know, the intracranial infection is a clinically diagnosis. This is the clinical diagnosis disease. But the radiological rule is for confirm the diagnosis first. Second, assessment the mass effect of the lesion on the brain. Any intracranial lesion, the important or the dangerous of this lesion dependent on mass effect and effectiveness on the brain. So the detect mass effect compression upon the adjacent brain parenchyma is the rule of radiology. 3. Assessment if there is any other lesion like underlying causes or if there is complication of the infection and other. Aid for surgical planning. Aid for surgical planning. Forming of intracranial infection. What's the type of the intracranial infection? First, cerebritis. What's the meaning of cerebritis? Cerebritis is the local infection of the brain parenchyma. Infection involving the brain parenchyma, which is local, just small area of the brain parenchyma affected by this infection. Okay, and it's involved the brain itself. Mostly it's bacterial type. Mostly the cerebritis is a bacterial infection. The radiological feature of cerebritis in any type of infection. The MRI is the method of choice for the diagnosis and follow-up. MRI is method of choice for the diagnosis and follow-up of any type of brain infection. But if we are started with a CT scan because it is available, because it's low costy, okay? So I mentioned the radiological feature on CT scan and on MRI. But the rule of the diagnosis and follow-up method of choice is MRI. Now, on CT scan, the cerebritis appearing as a hypodense area. Involvement the cortex and subcortical. Cortical and subcortical. Hypodense area appearing in cortical and subcortical with minimally edema or mass effect, none or just minimal enhancement. Really, I don't see any enhancement in CT scan in cerebritis till now. On MRI, the cerebritis in T1 appearing as a hypo-intense area, on T2 appearing as hyper-intense area, hyper-intense meaning brightness, with gadolinium minimal heterogeneous enhancement. Okay, this is the appearing of cerebritis. The cerebritis is the first stage of infection. If it is neglected or misdiagnosis or poor management, it will be complicated to formation of a brain abscess. So the early cerebritis may be developed to formation of brain abscess. But the second form of infection is a brain abscess. Brain abscess also it's local infection of the brain. Locally infection involvement single area of brain. In this infection we can see there is a rarely capsule. There's a capsule, thick capsule, and containing area containing pus, thick fluid, debris, and here there is a marked edema and mass effect. Appearing marked edema and mass effect, and the condition will be more obvious radiologically, more obvious and more clear in radiological examination. Now, the radiological feature of abscess in CT scan, the abscess have double wall. Double wall mean the outer wall is hypodense. The outer is hypo, while the inner is hyper. Double wall. This is the double wall sign. Inside, it is the fluid, so it's appearing as hypodense, surrounded by edema and showing marked wall enhancement, rim enhancement after contrast. Okay, on MRI, it's appearing in T1, hypo-intense, but it is less than the CSF fluid, because the CSF fluid, it's a clear fluid, so it's appearing darker than the abscess. Okay, T1, it's appearing bright, hyper intense, but also it's less than the CSF, because the CSF is clear fluid, appearing hyper intense area surrounded by hyper intense edema, and associated, and in gadolinium enhancement there is a rim enhancement. Looking for this imaging, this is the imaging of CT scan and MRI, pre and post contrast, showing the developing of abscess. In first image onto the left side, we can see there is the early sign of cerebritis. CT scan, pre and post contrast, hypo dense area, ill-defined, mildly edema, mildly mass effect, involvement of the cortex and subcortex. Okay, no or minimal enhancement. After days, there is increase in darkness, there's increase in hyper density, meaning there is the liquefaction in the area, and also the enhancement is become more obvious. Okay, this is the third image, is MRI T1, pre and post contrast. As we can see in T1 weighted image, there's a hypo intense area. After contrast, there is a rim enhancement. Completely rim enhancement. This is the complete rim enhancement, meaning the patient will have abscess. Last image is the same patient. Here the MRI, for imaging is the CT scan. As we can see, there's marked rim enhancement, completely rim enhancement, marked edema. This is the brain abscess. This is the staging of development of brain abscess from the early cerebritis and then to late capsular well-defined abscess, brain abscess. Now, encephalitis. Encephalitis, it is inflammatory of all brain. Inflammation, involvement all the brain. It is a systemic disease. Inflammation, involvement all the brain. Mostly is viral and it's self-limited condition. But if it is not treated well, may be development to complication to meningoencephalitis. Maybe meningoencephalitis as complication of meningitis, or it's complicated to meningoencephalitis, or maybe complicated to brain abscess. But encephalitis itself, it's viral brain infection, which is the involvement generalize all the brain and is self-limited condition. Radiologically, CT scan in early stage is completely normal. So if the patient have a clinical sign of encephalitis and the brain CT scan is normal, that not excluded the encephalitis, it's not excluded. Later on, we can see there is a hypodense area, involvement all cortex and white matter of brain. There's effacement of the cell side due to the edema. Most area we can see it in the temporal lobe. When in progress or complicated development, there is a small area of petechial hemorrhage. We can see it as hyperdense petechial spots of hemorrhage into the cortex. When there is a progress and hemorrhage in bad management or delayed in diagnosis of encephalitis. Also in MRI may be appearing as normal in early stage, while in later stage may be showing there is T1, hypo-intense area, involvement all the brain. When there is development of hemorrhage in subacute stage, we can see there is the petechial of hyper-intense spot. Enhancement, minimal enhancement, which is taking gyriform or leptomeningeal enhancement. T2, there is mildly hyperintense all over the brain, mild hyperintense. As we can see in this image, this is the T2 weighted imaging MRI axial view, showing there's a hyperintense area, involvement both occipital lobe associated with edema, cortex and medulla. Okay, now how we can differentiate it, this imaging from edema associated with brain tumor, one, or edema associated with brain abscess, okay? Or how can differentiate this from infarction, okay? How can differentiate this image? The answer of these questions as following. This is the lesion is involvement bilateral occipital lobe. Bilateral occipital lobe. This is the against of brain abscess, which is mostly in normal immune patient is the single lesion. This is exclude brain. One, brain abscess. Two, why it's not brain tumor? Why we cannot see? I can see there's obvious edema because the involvement of the cortex. There's the hyper intense area involvement cortex and subcortical area, hyper intense in cortex and subcortical. This is exclude the presented of underlying tumor because the tumor not involve the cortex, the edema involvement only the white matter. Okay, that excluded the tumor. We can exclude the infarction because it's bilateral. Okay, and I said the infarction is involved in territories of artery, okay, in territories of artery, not jumping in multiple area of the brain. This is how we can differentiate this image from infarction or underlying brain tumor. This is the air imaging of encephalitis. Now, the fourth type of infection is meningitis. Meningitis meaning inflammation of the meninges. Meninges, it is the membrane covering the brain and spinal cord. And this is the infection coming from the fluid. The fluid, the CSF fluid, it's infected and causing irritant for this meninges, so it will become inflammation. ممكن يكون هنا الانفكتد bacterial أو ممكن يكون viral. ولهذا قلنا الانسيفالايتس ممكن تكون وياها شنو؟ meningo encephalitis. ممكن يكون وياها شنو؟ meningo encephalitis. يعني ممكن أن تكون combination بين الاثنين لأنه ممكن تكون viral أو bacteria. نعم، نفس الفكرة. المننجايتس clinical يعني condition. We can diagnose it clinically. This is the patient who have meningitis. Radiological rule here either to diagnosis of underlying causes like the patient have severe sinusitis or have the foreign body in the brain or have the wound in the brain, underlying causes, or for follow-up of the patient or for detected of complication. يعني لما يجينا مريض عنده meningitis clinically هو meningitis طلع CT scan مالته normal أو MRI مالته normal, this is not exclude meningitis. كل اللي راح نشوفه بالنسبة للCT scan أو MRI هو just there is edema in the brain. زين، وقلنا ممكن إنه إحنا نشوف إنه أكو leptomeningeal enhancement. بالCT scan ساعات يصير عندنا شنو hyper dense area surrounding the basal cistern. هذا يسمونه pseudo subarachnoid hemorrhage. هاي الصورة احنا شفناها بالسب اركنويد هيموريج. اذا تذكرون وحدة من زميلاتكم العزيزات سألتني على هذا السؤال، قالت شنو يعني سيدو سب اركنويد هيموريج؟ سيدو سب اركنويد هيموريج هو هايبر دنس تصير بالبيزل سيستم، يشبه الاكيوت سب اركنويد بس هو بالحقيقة هو مننجايتس، وموست كمان كوزز يكون تي بي مننجايتس. نفس الفكرة بالاماراي راح يكون فد مينيمال تشينج. هسه تشوفون هذه الفيتشرز. سي تي سكان اوف ذا برين، الصورة الأولى to the left pre to the right post contrast. راح نشوف اكو انفيس سلساي. انفيس سلساي معناته شنو؟ معناته absent رايحة السلساي، كأنما البرين مورم طابق يعني كله على بعضه. واكو بوست انهانسمنت جايريفورم انهانسمنت، راح تشوفون انه الجايراي صارت بيضة اكثر من اللازم. هنا نفس الشيء راح نشوف انه اكو ليبتو مننجيال انهانسمنت اللي هو جايريفورم، تشوفون انه الجايرا انخطت بخطوط بيضة واضحة. هذا الباترن مال انهانسمنت اوف مننجايتس. قلنا اهم شيء بالنسبة للمننجايتس هو الديتكتد مال complication of meningitis can be divided to early complicated and late complication. early complication اللي هي treatable complication. For the meningitis can complicated as cerebritis, okay, or brain abscess. Can complication as a local cerebritis or can complicated to brain abscess أو extra axial infection involvement بالmeninges as epidural أو subdural empyema. can causes epidural, subdural empyema. In ventricle, can causes ventriculitis, or can causes thrombosis. Thrombosis where? In the vein. Venous thrombosis. فالفينوس thrombosis راح يسوي لنا انفاكشن، فيصير venous infection. ذول الثلاثة هم شنو؟ هما early complication اللي we can't treat it. late complication اللي هو permanent damage. First, hydrocephaly, which is a type of non-obstructive or communicating hydrocephaly, dilated in all the ventricular system because the defect in the arachnoid villi بالabsorption مال السي اس اف يتجمع السي اس اف وين؟ بالventricles. واو. extra axial collection، احنا قلنا يصير عندهم شنو؟ يصير عندهم subdural او epidural empyema. لما هاي الامبايما يصير بها resolve راح تتحول الى collection، فيصير subdural collection or epidural collection. يعني هذا significantly ما إلى أي تأثير clinically، ما يأثر على البيشنت. late it is developed to encephalomalacia. Encephalomalacia meaning atrophy of brain. Encephalomalacia, atrophy of brain. This is the complication of meningitis. The last type of brain infection is hydatid cyst. The hydatid cyst is infection caused by Echinococcus granulosus, as you know, presented as the cystic lesion in the brain. This is the cystic lesion in the brain is have specific criteria. First is a thin wall. Second, containing clear fluid nearly similar to CSF density or intensity in CT and MRI. A third, which is important, it have no edema surrounding the hydatid cyst. In uncomplicated hydatid cyst in the brain, there is no edema surrounding the lesion. This is the only intra-axial lesion not associated with edema. And fourth, there is no enhancement after contrast. Fourth sign, no enhancement after contrast. Can complicated to another? Yes, can be when there is the multicystic, there is the daughter cyst inside the cyst, multicystic hydatid cyst. This is the maybe similar to astrocytoma or maybe similar to tumor in aggressiveness. Can be developed on abscess? Yes, can infected and development to brain abscess. Radiologically, looking for this image, left side T2 MRI weighted image, right side brain CT scan. As we can see, there is a well-defined, round, thin wall containing a clear fluid cyst. Looking, there is no edema, just mass effect, just causing compression because the volume, but there is no edema, no enhancement. Okay, this is the features of hydatid cyst. And thank you for your patience. Thanks.